As we think about bringing our adult learners together to truly engage in active learning, what are some of the challenges that you have? I know for me, oftentimes students aren't fully engaged, or maybe they didn't prepare for class before they showed up. So, how do we engage students in a discussion when they haven't done the reading, when they haven't done the required course review or content review before they come to class? Well, that's what we're going to talk about today because we know the impact of a backwards design model is critically important for our adult learners. It's going to help our nursing students develop the clinical judgment that we know they must have. All right. And so we probably have heard about beginning with the end in mind. So that's what we're going to talk about today. So before we jump into our content, I want you to think about when is the last time that you pulled your students together in a learning circle? When is the last time you gave them allotted time to really share their clinical experiences with each other in the didactic setting, or even just to engage in a thoughtful discussion, a thoughtful peer discussion about a specific concept? Well, we know that there's so much value in peer learning, and oftentimes, especially for our senior students, they really see more value in that in-person classroom time, giving them an opportunity to talk with each other about their experiences, to talk to each other about maybe a new innovative teaching strategy, learning strategy that's really helped them solidify the comprehension of concepts. As we look at the clinical judgment model, if you haven't lately, I encourage you to either the Tanner's clinical judgment model or the NCSBN clinical judgment model. What we see is that a big part of that learning journey of true comprehension of knowledge, students' ability to do that deep learning, is strongly tied to reflective practice. Okay, and so oftentimes what happens is students, when they're in these small learning circles, they end up truly spending time reflecting, because in order for them to share their clinical experiences, they have to think back to yesterday or last week. So we want to engage in these small learning circles so that our students have a chance to learn from each other, to engage in meaningful dialogue that will help them have a deeper comprehension of concepts. All right, so before we go any further, if you all are not aware, I want to bring to your attention that the book that we have been working on for quite some time, Rooted in Wisdom, is now available for pre-order. Okay, and the great thing is, if you're listening to this Snapshot live, then it's free. You only have to pay for shipping. All right, so take advantage of the opportunity you have right now to order our devotional. It's a 365-day devotional called Rooted in Wisdom. It really is about connecting our why with our what. So why is it that I am showing up every day for my students to help them through this learning journey? Why is it that I'm choosing to be a nurse educator? Because we know there are so many great opportunities as a nurse. So why are we choosing nursing education? And then the what. What is it that's keeping us there? What is it that we should be focusing on as a nurse educator to help us be better as a human and to show up better as a nurse educator? So it's a little bit of encouragement, a little bit of framework related to improving our abilities to truly demonstrate high-level competency as a nurse educator. So again, Rooted in Wisdom, you can go to drsellarseducate.com/rooted, and you will find information there about how to add your name to the list. All right, so before we jump into backwards design model, I want you to go ahead and pull out your study worksheet, and I want you to write down a couple of key points that we're going to cover in our time together today. So first, I want you to think about defining what evidence are you using to support whatever teaching strategy you're choosing. Okay, so what evidence are you using to truly plan out that teaching plan that you have for your students every day? And second of all, what activities are truly aligned with the teaching strategies? What are those active learning strategies that you're using in your teaching plan to help students stay engaged, stay connected to the concepts that we want them to learn? And then the third takeaway and consideration and reflection I want you to take time to do is think about cognitive load and mastery. So, what is that level of learning, looking at Bloom's taxonomy, that you expect your students to walk away with as a result of spending time with you? And then, how do students really process that information from a cognitive load standpoint? Do you feel like students are often overwhelmed with this concept when you're explaining it? Or do they have lots of light bulb moments and you feel like they have a high level of mastery related to the concept that you're explaining to them? Okay, so again, you're writing down 3 key takeaways. Number 1, what's the evidence to support your learning strategy? Number 2, what are the learning activities that are aligned with that strategy? And then number 3 is the actual cognitive level for the Bloom's taxonomy, the learning domain. And what is that load? Are students getting it? Are they connecting the dots or not so much? And then the level of mastery. Do you feel like students are having that deep comprehension or is it pretty superficial? All right, so now let's go ahead and go back to a couple of concepts and then we're going to look at our thought-provoking question. So when we are beginning with the end in mind, it's equivalent to running a race, right? You think about how much we train for a race, but we know ultimately what we want to do is finish the race, maybe even win the race. So it's the same thing when we think about our learning plans with our students. The race that students are running really is related to mastery of concepts. Students have to be able to demonstrate mastery in a way that leads to the delivery of safe patient care. So how are we helping students along the way? We know that there are going to be barriers, there's going to be hurdles they have to overcome. So how are we supporting them on that journey to get through all those obstacles, all of those challenges that they will experience throughout the race? So that's what we should think about when we consider beginning with the end in mind. We know there's a finish line, right? With every course, there's a finish line, even with every interaction we're having with our students. So how are we making sure students are crossing that finish line using both formative and summative evaluations? And how do we help students progress? How do we help them scaffold learning in a way that they are going to eventually develop those deep comprehensions, the deep comprehension of the concepts? So when we look at the backwards design model, we're focusing on those clear learning outcomes. What is the desire? I know we talk a lot about learning objectives, but what about the outcomes? So ultimately, what knowledge do I want my students to walk away with as a result of the time that we have spent together? Now, when we think about traditional versus backward design, we know traditional, yes, we have learning objectives that we want students to achieve, but it can be very confusing, right? Especially because there can be so many spaghetti loops, right? It can feel more like a maze as opposed to a direct path to that finish line. So that's what I want you to think about. When we're looking at a traditional model, is it a direct path? Have we done strong alignment? Or is it a little bit of a guessing game? Okay, so our ability to create this straight path is going to help not only us as educators, but also help students move through that learning journey, which we know is so essential when it comes to not only the comprehension of concepts, but application and analysis of those concepts as well. So backwards design, we are beginning with the end in mind. What's that outcome? Just like we started in our time together today, what is the outcome that you want to meet and ultimately have a positive result as it relates to the time that we've spent together? Okay, so now what we want to do is we want to go to our thought-provoking question. Okay, so let's go ahead and go there, and then we'll come back to some of the content, but I want to take you to the thought-provoking question. All right, so let me go ahead and put that here for us. While I'm pulling that up for you, go ahead and write down for me, what is that number one? So looking at number one, how are you right now? What is the evidence? How are you using the evidence that you're exploring as you're putting together content for your class? What is the evidence that is supporting your decision making about the content you're using? All right, so what is the evidence? Sometimes it's our textbook, sometimes it may be actually what we have learned about, such as during our snapshots, what we have learned about related to a specific concept. Okay, so again, what evidence are you using while I'm pulling up our thought-provoking question? What evidence are you using to really validate and to integrate your work or to integrate into your teaching plan so that students have a strong alignment with the concepts that we're teaching about to the actual evidence, right? That's our goal. We want students to have that deep comprehension of knowledge. All right, so you're building a respiratory module to help your students have a deeper comprehension of as it relates to application for care of the heart failure patient. So again, you're building a respiratory module to help students have a deeper comprehension of care of the heart failure patient. What's the first backward design step? Okay, so A, list lecture topics aligned with outcomes. B, specify performance outcomes. Or C, create engaging presentation slides. All right, so I'm gonna read those again for you because I know you can't see it. So A is you're going to list lecture topics aligned with outcomes. The question is, what's the first backwards design step? B, you're going to specify performance outcomes. Or C, create engaging presentation slides. All right, so I'll give you a chance to kind of think through what you think the correct answer is and the rationale, and we'll keep going. All right, next we want to talk about an effective implementation plan. So first is clarify. So when you're clarifying, it first starts with you having clarity around what are those learning objectives that really are going to validate for us as educators that students are actually learning, right? So clarification is key, and that first starts with us having clear understanding, strong clarity around what our learning objectives are. And then second of all is alignment. How do our assessments, how do our discussions, both formative and summative assessments, quizzes, exams, papers, how does that really align with those learning outcomes that I have identified? And then what's that rigor? So we think about that, the actual cognitive load. How are my students with connecting the dots? Am I getting a lot of deer in headlights looks, or are students really having a deep comprehension of concepts? And then last is active engagement. So how am I actively engaging students on this learning journey as they move forward? So again, I want to think about clarity. I want to think about how it aligns. I want to think about academic load or academic rigor, cognitive load, and engagement. How connected are my students to the content? Are they staying engaged, or am I losing them? All right, some examples in action could be curriculum planning. Effective curriculum planning starts with clear goals and outcomes that really are guided, that help guide our educators. And then lesson design. And then third is project development. You know, oftentimes when we think about this journey we're going on to make sure we're clear about our outcomes, it takes a village, right? So we want to think about that as we are moving forward with our backwards design model. And then as we wrap up, essentials of the backwards design model, you want to identify your results, you want to determine the evidence, and you want to plan those experiences, right? So if we go back to our question, our thought-provoking question, which you can see right here in the description. So if you chose B, give yourself a round of applause. B was specify performance outcomes, right? That is the first step in adopting and aligning with the backwards design model, because we want to begin with the end in mind, which means that we want to be clear about what those learner outcomes are. If you didn't choose the correct answer, that's okay. Just make a note. You want to make sure as you move forward that you're clear about your why. Our ability to truly engage students and to follow this framework first starts with us as educators having a deep understanding of who's in the room with our students, what are our learning outcomes, what is it that we want our students to walk away with, and most importantly, what is our understanding of the content that we are sharing with our students. As you're moving forward on your journey towards CNE or becoming a better nurse educator, we want you to join us on this journey. You don't want to do it alone because there's so many obstacles, there's so many distractions that can happen. The only way you won't achieve success on the CNE exam is if you quit. At Dr. Sellars Educate, our mission is to support all nurse educators to achieve success on the CNE exam, and we've added now on your first attempt. Okay, so we have a 97 to 100% success rate when following our 7-week study plan. DrSellarseducate.com is where you can find information about all of our programs, and we look forward to seeing you in the next snapshot. Have a great one, everybody.